Hello, everyone, and welcome back to the second day of AIDSWatch Throughout to Resiliency. My name is Drew Gibson. I'm the Policy Manager for HIV and Drug User Health at AIDS United, and this session,
Y esta sesión
Advocacy and Get Out the Vote
de salir a votar
in the 2020 election.
en la
The webinar is
elección
being
del
interpreted
2020.
live in American Sign Language.
Esta sesión está siendo
So if you see the ASL interpreter on the top and you would like to use it during the session, please click on the three little dots and pin it to your screen now. The webinar is also available in Spanish. If you click on the globe icon for interpretation in the bottom and select Español, you can listen to the webinar in Spanish as well. So like I said, my name is Drew Gibson, Policy Manager for HIV and Drug User Health at AIDS United. Really excited to have this panel for you today with some really amazing advocates that I'm really looking forward to hearing from. But I feel I would be remiss if I didn't acknowledge the extremely troubling and bizarre circumstances that we find ourselves in right now. Watching as much as I could stand of the debate last night, I couldn't help but think back to our second panel yesterday on racial justice and decentralizing whiteness, as we saw a sitting president make an open plea to a white supremacist terrorist group to stand by during a presidential debate with Vice President Biden. White supremacy has always been a part of American society and life, but the degree to which it is being blatantly wielded and weaponized this election is unique, at least in my lifetime. And I think it's worth acknowledging at the outset that folks on this call are not alone, that we stand in solidarity with one another, and that it is okay to be scared. And also that hopefully, as we'll find through the rest of this panel, that we can use our vote as a tool in a larger toolkit to try and fight back against violence and uplift the voices of Black and Brown peers in this movement and ensure that we have a more just and equal society. So with that, I would like to introduce our first panelist, Aisha Davis, who is the Director of Policy at AIDS Foundation Chicago. As Director of Policy, Aisha's work at AFC involves monitoring and analyzing federal policy as it relates to people living with or vulnerable to HIV, including federal healthcare policy and Medicaid. Prior to joining AFC, Aisha dedicated her legal career to civil and human rights advocacy and has worked both domestically and internationally. She calls Chicago home now, but was born in Washington, D.C. and raised there in the Prince George's County area. Growing up near the nation's capital inspired Aisha's passion for advocacy, and her family's influence sparked her desire to use her voice for the betterment of her community. She obtained her JD from Columbia Law School and received an LLM from the University of London in Human Rights, Conflict, and Justice. Completed the degree program with a dissertation on intersectionality and international human rights. It's my pleasure to introduce Aisha Davis as our first speaker.
Good afternoon, everybody. I'm very happy to be here. And like Drew said, my name is Aisha Davis. My pronouns are she, her, hers. And I'm the Director of Policy at AIDS Foundation Chicago, which is located on occupied Kickapoo, Peoria, Potawatomi, and Miami land. As was previously stated, we are here to talk about advocacy and voting during the COVID-19 pandemic. While my esteemed co-presenters will speak in more detail about the process of voting and what this election cycle holds in the balance, I'm going to start by grounding us in an understanding of how voting is just one of many tools that we can use for advocacy, and why this is actually a tool that may or may not be seen as effective for voters, especially Black, Indigenous, and Latinx voters. Next slide, please. First, I'm gonna start with a speech that everyone is probably very familiar with and an image that you've probably already seen a few times. But leading up to the Civil Rights Act of 1964, advocates and activists participated in the March on Washington, my hometown. This is often seen as a much more optimistic and recognized speech that talks about equality. There were a ton of comments throughout this speech that I could have pulled, but I started right here because this is something that we have to remember even to this day. So on August 28th, 1963, which was over, 40 years ago almost, Martin Luther King Jr. was saying, that 100 years later, the Negro still is not free. 100 years later, the life of the Negro is still sadly crippled by the manacles of segregation and the chains of discrimination. 100 years later, the Negro lives on a lonely island of poverty in the midst of a vast ocean of material prosperity. 100 years later, the Negro is still languished in the corners of American society and finds himself in exile in his own land. So while this is a speech that's often kind of pointed to talk about how MLK was a champion for equality and really was someone who pushed for peaceful protests and civil unrest, it also was a speech that recognized that we are not where we needed to be in securing voting rights or even establishing civil rights for Black and poor people in the United States. Notably, MLK stated that Black Americans are still in exile in the land that they not only know as home, but built for free during the horrific period of slavery in this country. Next slide. Next is another champion of the civil rights era and someone who's often kind of put at odds when people talk about MLK. But I would argue that these two activists are actually much more in line with each other than folks would like to think, because both of their struggles were seeking equity for Black people in America. So a year after the March on Washington and the famous I Have a Dream speech, Malcolm X delivered The Ballot or the Bullet, which was a speech that has been remembered as something that was more militant or a little more, I guess, disruptive than MLK's speech the year prior. But I really wanted to point to these lines that I put in the slide. I am one who doesn't believe in deluding myself. I'm not going to sit at your table and watch you eat with nothing on my plate and call myself a diner. Sitting at the table doesn't make you a diner unless you eat some of what's on that plate. Being here in America doesn't make you an American. Being born here in America doesn't make you an American. Why, if birth made you an American, you wouldn't need any legislation. You wouldn't need any amendments to the Constitution. You wouldn't be faced with civil rights filibustering in Washington, D.C. right now. So this conversation, or this speech, I should say, is a part of a larger conversation when the Civil Rights Act of 1964 was going through the US Congress. And this is a speech that folks often like to point to as Malcolm X talking about using violent self-defense. However, I think we should be focusing on the self-defense aspect of that phrase, right? So even then, a year after MLK's speech, after the assassination of JFK, we're talking about still fighting to secure voting rights and civil rights for Black Americans. Next slide, please. Now we're gonna fast forward quite a few more years and bring us right into 2020. In the midst of everything that was happening during the COVID-19 pandemic, we also saw lots of protests in response to the very violent and horrific murder of Breonna Taylor, of George Floyd, and of numerous other unarmed Black people throughout this country, and actually in other countries as well. Because I don't want to forget the fact that anti-Blackness is a global issue. It's not something that is specific to the United States. But I do want to point to this part, which I believe was the end of Kimberly Latrice Jones's speech, which has been dubbed, "How Can We Win?" You broke the contract when you killed us in the streets and didn't give a fuck. You broke the contract when for 400 years, we played your game and built your wealth. You broke the contract when we built our wealth again on our own, by our bootstraps in Tulsa, and you dropped bombs on us. When we built it in Rosewood and you came in and you slaughtered us. You broke the contract, so fuck your Target, fuck your Hall of Fame. Far as I'm concerned, they could burn this bitch to the ground and it still wouldn't be enough. And they are lucky that what Black people are looking for is equality, not revenge. The only thing I would change about that last sentence would be to say that we're looking for equity, not equality. I believe that the conversation around equity and equality has to be delineated, especially when we're talking about racial justice and racial equity today, and especially in the context of voting and actually getting out the vote at a time like this. Like Drew said earlier, last night was difficult for many of us to sit through and listen to. And it's not surprising that some people are not very interested in talking about voting as the main source of civil rights or a main source of voicing our needs in this country, when we have seen what has happened when we are trying to have the people we've elected actually stand up and support the needs and equity of Black folks. I also will say that Black folks are not unique in having their civil rights ignored and having their bodies disregarded and harmed and face violence in this country. I specifically would like to say that Black, Indigenous, and Latinx folks have faced significant struggles and harm and violence. Asian Americans and other Asian folks have faced significant harm and violence, including the added xenophobia that has come about because of the COVID-19 pandemic. So with that all being said, it is difficult to say that voting is a thing that we are pushing and saying that someone must do without acknowledging the fact that there are justifiable reasons why some folks might not feel like voting is the most efficient or effective way of having their needs met in this society. Now I'm going to turn to talking about what voting rights has looked like in the evolution of this country. Next slide, please. So this is a picture from one of the suffrage marches in 1913. And I just want to give a rundown of the history of voting in the United States and just talk to you about some pretty significant milestones. So starting in 1776, only landowners could vote. And I think that when we think about what a landowner is, it doesn't actually provide enough context to who we're talking about that could actually vote in 1776. Those landowners were by and large Protestant white men over the age of 21. And to add an even more clarifying point to it, I would say it is Protestant cis white men who were able to vote. Because we all know that LGBTQ issues and LGBTQ rights were not a thing that was talked about as much in that era. Following that, in 1790, naturalization laws were passed and only free white immigrants could become naturalized citizens in this country. In 1856, all states allowed all white men to vote. So still we're seeing that racial discrimination was happening in terms of voting rights, and we're seeing that gender equity was not something that we had even gotten close to at that point. In 1870, the 15th Amendment was passed and stated that the right to vote could not be denied because of race, but other measures such as voting taxes and literacy tests were still permitted. So again, you see the legislation is trying to push us in the direction of equity, but there are still significant obstacles and barriers to actually being able to vote. In 1876, the Supreme Court ruled that Indigenous Americans are not citizens and cannot vote. So on top of having the land be occupied, on top of tribes being slaughtered, on top of people being run off of the land that they've been on for thousands of years, you have a Supreme Court stating that you're not even a citizen in the land that has been yours. In 1882, the Chinese Exclusion Act banned Chinese people from being naturalized, and therefore they could not vote. In 1887, the Dawes Act granted citizenship to Indigenous Americans, but only if they gave up their tribal affiliation, which was a large part of the assimilation plan for the United States for Indigenous Americans. 3 years later, in 1890, the Indian Naturalization Act granted citizenship to Indigenous Americans. In 1920, the 19th Amendment passed, which permitted women to vote. Now, as another caveat, we have to also remember that the suffrage movement was not one that we could call intersectional in any way. There were numerous instances where white suffragettes were purposeful in their attempt to kind of throw Black women and other women of color under the bus in an attempt to really solidify their own voting rights. In 1924, the Indian Citizenship Act granted citizenship to Indigenous Americans, but permitted discriminatory voting laws that would prevent Indigenous Americans from voting. And finally, in 1947, almost 200 years after this United States was formed, Indigenous Americans were granted the right to vote. 1952 permitted Asian Americans to vote, and in 1965, the Voting Rights Act passed, which forbids states from imposing discriminatory restrictions on who could vote, and actually gave a little bit of authority for the federal government to watch and figure out when states were trying to put laws in place that would be discriminatory and prevent people from accessing the right to vote. In 2013, sadly, the Supreme Court weakened voter protection in the case Shelby County versus Holder by limiting federal oversight, which then led to the purging of voter rolls, imposing voter ID laws, limiting the number of polling locations in states, and cutting voting times around the country. So this all existed on top of the disenfranchisement of people convicted of felonies, because still today, in some states, you cannot vote if you've been convicted of a felony. So I just wanted to give that backdrop to show that even though it's something that we are often told is a civic duty, it's something that's a responsibility, it's something that we all should be able to access, voting rights have never actually been equitable in this country. And as a result, there's a reason, and a justifiable reason, why a lot of people do not see it as their best tool for advocacy. Next slide, please. Now, when you complicate this all with the conversation around COVID-19 and how this pandemic has affected folks, we're seeing that there have been a number of measures put into place to try to figure out how to make voting as safe as possible. For communities of color, especially Black, Latinx, and Indigenous communities, this is something that has kind of thrown us into another precarious situation, because we're being told to rely on different systems to protect our vote, meaning we're being told to mail a ballot in or try to go and vote early. And there's this pressure that's being put on a lot of communities of color to get out and vote, to try to see some change in this country. When you're looking at the statistics around COVID-19 and how this pandemic has affected communities based on demographics, it's easy to see why there would be a lot more concern around voting and getting out and actually going to vote in Black, Latinx, and Indigenous communities. Next slide, please. The COVID-19 is not the first time where race and health in the United States have kind of resulted in concerns and discrimination. So over the course of this country's existence, we have seen numerous instances where people of color have been used almost as test subjects for the advancement of medical science, right? So that includes having early OBGYNs operating on enslaved Black women without anesthesia, without consent. It also includes harm coming to Indigenous women who were sterilized. It includes harm coming to Asian women who were in internment camps. It also includes Latinx and Indigenous women, not only on the continental United States, but also in Puerto Rico, being harmed and facing all kinds of medical harm, or medicalized harm, I should say. So the COVID-19 pandemic is not the first time that we've seen discrepancies in health outcomes. In addition, for all of those who are familiar with the conversation around the social determinants of health, it's clear to see that racism is a public health crisis in this country. There's nothing about any community of color that makes us more predisposed to having certain illnesses or certain health complications. In fact, it is the racism that these communities have experienced that has led to these health discrepancies. So when we're talking about who has a shorter lifespan, when we're talking about who is more or less likely to have high blood pressure or diabetes or cancer, it's not because these communities are unhealthier or that we are less able to take care of ourselves. It means that by and large, these communities are either under-resourced when it comes to having access to health resources, in addition to having less access to equitable education systems, having less access to food, having less access to any kind of system that would support our betterment and well-being, in addition to discrimination around the areas of employment and housing. So all of these things combined have caused a kind of perfect storm of harm coming to a lot of these communities. On the slide you can see, and I'm not sure how visible it is for folks if you don't have the screen enlarged, but when we're talking about the cases of COVID-19, you can see that when you're looking at the mortality rate for American Indian or Alaskan Native or a non-Hispanic person, so any Indigenous person, they are 1.4 times more likely to die from COVID-19 than white non-Hispanic people. When you look at Black or African American non-Hispanic people, we are 2.1 times more likely to die from COVID-19 than white folks. When you look at Latinx folks, they are 1.1 times more likely to die from COVID-19 than white folks. And if you look at the line above, when we're talking about hospitalization, that's not something to ignore either, right? Of course, if you go into a hospital, you get better and you come home, that is something to celebrate. But what's not something to celebrate is the fact that our medical system is so toxic and harmful that a lot of folks won't be able to afford any of these hospital bills after they're done. In addition, we don't know what COVID-19 will look like for folks who have recovered. So in this whole issue of talking about how we're going to get folks out, how do we advocate, how do we stay connected during the COVID-19 pandemic, we have to make sure that we are taking into consideration all of the things that folks see as barriers to being able to vote. It's not just about where a voting location is. It's not just about how long the offices are open or how long you can vote in one day. It's not just about early voting or mailing ballots or if folks are registered to vote. It's also acknowledging the fact that we are seeing right now a time in our country where a pandemic has hit and we are being told to accept the fact or not be livid about or not react to the fact that we are facing death more than 2 times white folks are experiencing it during this pandemic. Next slide, please. And I would be remiss if I didn't talk about the fact that it's not just about health, it's not just about voting, it's also about the fact that this is a country that has shown time and again that people of color, especially Black, Latinx, and Indigenous folks, are not seen or treated as equal in this country. Even when harm has come to us, even if you have a civil settlement from a police department because of a wrongful death, there still might not be criminal charges, as we saw in Breonna Taylor's case. We know that this is a time in our country where we're talking about racial equity and we're talking about racial justice, but we also have to remember that this is something that is weighing on communities of color every single day. So it's not a separate conversation when we're talking about voting. We all know that voting can bring some changes, and we all know that voting can put folks into office who are saying the things that we want to hear during a campaign. But what we need is for other communities to come behind us and be with us when we're trying to hold folks accountable for the things that they talked about during their campaigns. And we're trying to actually make them fulfill those promises that they've made to us. Next slide, please. So I'm gonna end by saying that you have to remember, voting is just one of many tools available for us to be heard. Protest is another way for us to be heard. Doing work in communities is another way for us to be heard. Volunteering, donating to organizations that support civil and human rights, working in collaboration and coalition with other organizations if you're someone who works in a nonprofit. All of these things are ways for us to advocate, and there are ways that we should be supporting other people becoming civically engaged and not just relying solely on voting. Next slide, please. So I want to close here and say thank you all for listening. I hope that you all have a little bit of a better understanding as to why voting is just one of many tools that we need to use when we're talking about advocacy and really recognizing what we need and getting our needs met in this country. If you want to reach out to me, my information is on the slide. I will be here for the Q&A session. And now I'll just go ahead and turn it back over to Drew to introduce the next presenter. Thank you.
Thank you so much for that, Aisha. It was a wonderful presentation and really sort of set the groundwork for what our next 2 presenters will be talking about. So next up, we have Nana Khanna from Positive Women's Network USA. Nana is a national speaker, trainer, and advocate who has worked in HIV since 2005, following her HIV diagnosis in 2002. She currently serves on the board of directors of AIDS United, the National Steering Committee for the U.S. People Living with HIV Caucus, as a member of the Women's HIV Research Institute, and served on President Obama's Advisory Council on HIV/AIDS from 2010 to 2014. And it's also somewhat fitting that prior to working in HIV, Nana co-founded and served as the National Field Director for the League of Pissed Off Voters, something I don't think anyone here can identify with. So with that, I will give it over to Nana.
Great. Thank you so much, Drew. Thank you to AIDS United, the Caucus Treatment Access Expansion Project for convening AIDSWatch, and a huge thank you to Aisha for just grounding us so clearly and so well in the conversation that we absolutely need to be having today. 34 days before the election. And I want to start off by saying that, you know, number one, I 100% do agree that voting is only one tool in our toolbox, and we must be focused on building long-term power as communities and understanding what that looks like. And that said, I do believe that voting is a critical tool that we would be foolish not to take advantage of in this moment if we can. And so there is, you know, voting is a mechanism, it's a harm reduction mechanism really for our communities. I think if anybody saw the debate last night, one of the things we saw is that this administration, the current administration, the powers at play are like openly descending and trying to take us all into a really dark fascist place, right? We're living in basically a fascist regime, and we get to make a choice right now about how we are going to take steps to try to protect our communities. And not all of those steps are about voting. Some of those steps, by the way, are about taking care of our people, making sure that our folks have access to medication, to food, protecting our folks from these armed white militia forces that are already terrorizing our communities. You know, federal agents have been deployed in multiple cities in response to the uprising across the country. Some of the things that Aisha talked about, sterilizations of people of color, are still continuing to happen today. We see that even in our own community. And certainly we saw recently reporting from ICE sterilizations of women in detention facilities. And so, but I do think that there's an opportunity that the HIV community has, building on the legacy of organizing, resistance, and advocacy that we have built to mobilize our communities and the vote. So next slide, please. Just a little bit about Positive Women's Network. We are the only national organization in the US led by and for women and trans people living with HIV. And we basically focus on building power of our constituency and our base. Next slide, please. Many of our policy priorities, and I know a lot of the issues that folks work on in this community, you know, from healthcare access to economic justice, reproductive justice, ending criminalization, trans rights, safety and justice, ending violence against our communities. Every one of these issues are things that we have been fighting for as an HIV community for decades, that PWN fights for every day. This is our policy agenda. And every single one of these issues are on the ballot. They're on the ballot for November 3rd. But in truth, the election has already started. And I'm going to talk about that in just a minute too. And so we get a chance to make our voices heard in this moment. Next slide, please. So I think we are probably all clear about what is at stake. Healthcare, protecting the Affordable Care Act is at stake. The future of our judiciary, Supreme Court nominations is at stake. This administration and multiple political leaders who have attempted to define transgender people out of existence. LGBTQ rights and dignity are at stake. This national conversation about racist police brutality, racist policing of our communities, cops openly demonstrating their ties to white supremacy groups and not being held accountable for violence and death perpetrated on Black and brown people. All of that is at stake. A second pandemic, you know, in the form of COVID-19 and its response, and really our understanding of science, period, and whether science is considered a real thing, that is also at stake. And so everything is on the ballot this year in terms of how we think about ourselves as a country, how we define our responses, and who we really center as in terms of bringing justice to our people. Next slide, please. And we do know that also when people vote, some things become possible. Not everything becomes possible. And I certainly don't want to give the impression that electoral politics is the only avenue to engage. But because the HIV community is already well positioned and has been organizing and advocating and delivering services and linking people to care and all the things that we do every single day to take care of our people, we have also built power in particular ways, and we have a large base that can be deployed in this moment. And so we saw, you know, for example, even recently, we've seen success on longtime community organizing campaigns because part of their campaign tactics were also choosing their targets that they were going to put in office. And so in San Francisco recently, we had a progressive district attorney who was elected, who has subsequently ended cash bail in San Francisco. In Minneapolis, during the uprising this summer, we saw the Minneapolis City Council vote to, towards the vision of defunding the police, towards replacing some funding for the police with community-led models. And that was not something that just happened in a flash in response to the terrible murder of George Floyd, but it is also a result of long-term community organizing that actually placed certain folks on that Minneapolis City Council, progressive, mostly young Black people who voted, in alignment with what their community was demanding, because they were also aligned with this vision for abolition, right? So these are some of the things that become possible when we do choose to deploy electoral politics as one tool in our toolbox. Next slide, please. Some of the things that are on the ballot are, explicitly the issues we work on every day. District attorneys and judges are making decisions about bail, about HIV criminalization. City council members are making decisions about your city budget. Attorney generals making decisions about the rights of trans folks in your state when they're incarcerated, prison and jail conditions. At the state level, Medicaid, reproductive rights, HIV criminalization, sex education, all of these things are on the ballot. And then of course, Congress and the president take action on reproductive rights, healthcare, housing, who sits on the Supreme Court. Next slide, please. So, in addition to candidates on our ballots, there are actually a lot of issues, like direct issues on our ballots as well. And so a couple of examples of issues that we are working on this election cycle include in Philly, there are 2 questions on the ballot that we're working on. One is question 1, which would end illegal stop and frisk. So this is something that the voters have a direct opportunity to vote on. Are things going to be perfect if question 1 passes? No, but it is a step. This is also, it is a step, and it is also a way to start building more momentum towards this issue. Question 3 on the Philly ballot would create a citizens oversight commission for the police. So these are among a set of a bunch of questions that Philly voters are going to be voting on are already voting on, actually. Voting in Pennsylvania started yesterday. As we're contacting voters about these, we're phone banking them, we're text banking them. A lot of folks don't know that these issues are on their ballot. People are very familiar with, obviously, the presidential race. They're not as familiar with everything down ballot. And it's critical that we inform folks, because sometimes people skip that part of the ballot. They may just vote on the races they're familiar with, candidates whose names they know. They might skip all of the issue questions. And so doing some voter outreach and education on this is important, both to support folks in making informed choices about what happens in their communities, but also because this is also a powerful motivator for people who feel like none of the candidates are really accountable on their issues. Well, here's a chance to vote on the actual issues. In Colorado, we are working to stop an abortion ban that's on the ballot. Proposition 115 is a step towards banning abortion in the state of Colorado. We are also working on a Proposition 118, which would expand family medical leave. That is also directly on the ballot. It would benefit like 2.6 million Coloradans who are mostly working class folks and low income folks. Next slide, please. So we also know that elections can swing by sometimes small margins, relative to what we think is possible. And so when folks say my one vote doesn't make a difference, or I just don't think I have the time, I have too much going on to really vote. Well, in the year 2000, the entire presidential election swung by 537 votes in Florida, as you may remember. In 2016, because we have this terrible system known as the Electoral College, the presidential election, even though the Democratic candidate won by 3 million votes, won the popular vote, actually, when you do the electoral math, the election came down to less than 80,000 votes in Pennsylvania, Wisconsin, and Michigan. And so That's not a lot of votes. You know, some calculations have shown that in, I think in Chester County, Pennsylvania, what swung the electoral votes in Pennsylvania was 5 votes per precinct in Chester County. And so, you know, I know anybody on this webinar can bring 5 people to a polling place and turn out the vote. And there are 1.1 million people living with HIV in the United States and millions more connected to services. Next slide, please. So I think Aisha already talked a little bit about some of the barriers our folks are facing to voting, and these barriers are not accidental, they are very deliberate. One of the things that is really outrageous and frustrating is this narrative that if Black people and people of color would just show up, we would win. Well, guess who has been showing up? Black people, especially Black women, have been showing up consistently for elections, for electoral politics, time after time, through so many barriers and so much opposition, including direct disenfranchisement, threats, violence, in addition to, like, you know, not even having the right to vote at many, in many ways. Meanwhile, we have a problem with the president last night literally calling for, basically for white militia to show up at polling places. So talk about barriers and disenfranchisement, you know, kind of like added to the COVID pandemic, mixed messages, the president trying to undermine the narrative around voting, around mail-in voting, around whether the election will be fair. We have a pandemic, and then we have things like 200,000 voters in Georgia being purged from the voter roll. So there is, you know, when folks are trying to make it this hard to vote, it's for a reason. It's because they want to retain power. And so we have vested interests that are trying to retain access to power because they are threatened by shifting demographics and changes in power around how, you know, how the country is changing. Next slide, please. Next slide. So, but our community is strong and our people have always struggled and fought back. And so I believe this is entirely possible. And I'm going to talk about a couple of concrete things we can do. You can go a couple more slides. So what we're, you can go maybe 2 more slides. Yeah, thank you. We have an opportunity right now to really elevate issues that are important to our community, to increase voter turnout, make sure folks understand what's on their ballots, build concrete skills for people most directly impacted by the issue to influence election, and to leverage our organizing power into votes at the ballot box. Next slide, please. So there are ways to vote safely in a pandemic, and we need to make sure our people know that. We also know that opposition forces don't want us to vote. We want to make sure that folks know what's on their ballots and are voting all the way down, and understand that every single vote really does matter. Whether you live in a presidential swing state or not, there are lots of local and state races where your vote really does matter if you participate. Next slide, please. So here are a few things you can do right now. And the thing, you know, I submitted these slides before the debate last night, but the number one thing I would say is, like, if you're a white person, please go get your people right now. That is actually the first thing that should happen. So we have, I think most people know somebody who is either planning to, like, sit this out because they don't see a difference between the presidential candidates at the top of the ticket, or you know, are saying that they're sort of still undecided about the presidential race and other things going on. I want to really implore folks. We saw what happened with the vote in 2016. We saw in particular how the vote broke down demographically, with white voters across different demographics voting for the candidate that had run on an explicitly xenophobic, racist platform. That was fully on display last night. My, like, number one ask to all white people on here is to contact the folks, your family members and your relatives, and, like, work on them right now. Work on them. You know, anyone you know who's, like, on the fence, please work on them. This is person-to-person organizing, relational organizing, and you're the one who maybe can make a difference in changing their mind or getting them to sit this one out. Also, everyone should check and confirm their registration status. Deadlines to register and to fix registration errors are coming up very soon. You can check those at vote.org. Deadlines to register are coming up as soon as Monday in some states. So this is the time to do this right now. As I said, like 200,000 voters purged from the voter rolls in Georgia. I just talked to someone the other day who votes every single time in the city I live in, who had an issue with her registration status as well. So even if you think you're registered to vote, even if you've already registered, you've already voted a million times in the same place, check your registration status right now. Check if you can request a mail-in or absentee ballot. You do not have to return your mail-in or absentee ballot using the mail system. You can drop it off in person, but it is good to still request a mail-in or absentee ballot. It gives you more options. You can drop it off at a ballot box. You can drop it off at an early voting location. You can take time and fill it out at home. You can have a ballot, filling out party with your friends, with your pod, your COVID pod, or you could do it online with your friends. We do ballots and brunch and things like that to make sure that folks understand everything on their ballot, talk it through, vote all the way down. And get involved. Whether you have 1 hour or lots of time, democracy needs you, the climate needs you, reproductive rights need you, your LGBTQ family needs you, immigrants need you, Black people need you, people of color need you. This is the time to throw down. Whatever time you have between now and November 3rd, we need it. Your skills can be used, you can be trained. Next slide, please. So just a couple things about voting safely in a pandemic. Next slide. Again, I would just emphasize the request a mail-in or absentee ballot and turn it in person early. That's my top recommendation for ways to vote. Second recommendation, if you are trying to figure out how to vote, is in-person early voting. This is a good way to reduce risk of COVID. We know that a lot of folks don't prefer to vote by mail. That is understandable, but go to an early voting location in person. There are lots of those coming online, and it's changing in different cities and different counties. Some of this is changing by the day. So Philly was supposed to open 17 early vote locations yesterday. They actually opened 3 in the morning. Now there are 7 open, is my understanding. There's a golden window in Pennsylvania happening right now that a lot of people don't know about. It's 3 weeks of time where folks can register and vote on the same day at these early voting locations. That is happening right now. So there's a lot of work to do around, educating folks about options to vote, and the fact that lots of polling places will not look like they normally look on election day. You can, of course, you can go and vote in person on election day. But I would say anybody who's on here, you're on here because you care about electoral politics, you care about voting, you're thinking about how to make a difference in your community. Nobody on this webinar, and I think there's like 150 people on this webinar, nobody on here should be voting on election day. We need you to vote earlier so that you're not contributing to the lines at polling places on election day. We also need you doing other stuff. If you have 2 hours to go vote on election day, then you have those 2 hours to do get out the vote work instead. And to be, working a shift, contacting voters, making sure they show up and vote. We also have unprecedented opportunities on election day, like, in Colorado, for example, on election day, people will be able to do same-day registration and vote. That means you can literally go and find somebody off the street who just moved there, didn't re-register, they can vote. They can register and vote on election day. So that's the kind of stuff we need folks doing on election day, not voting, please. Next slide, please. You can maybe go to a couple more slides because of time. So one more slide. So there have been a lot of concerns expressed. If you go back one, please. Some folks have expressed concerns about vote by mail. That is this something that's brand new? It is not brand new. About a quarter of voters nationally cast a mail ballot in the last 2 federal elections. There's no evidence that vote by mail leads to greater fraud. There are questions about the mail system and things like that. You can request a mail-in ballot and turn it in person. You can go towards my last slide in the interest of time. So, I would say, oh yeah, one more thing. On vote by mail, it's really important to make sure you follow the instructions exactly. In Pennsylvania, there was a ruling by the Supreme Court last week, basically warning that there are the vote by mail ballot in Pennsylvania comes with 2 envelopes, and if you don't sign both of them in exactly the right way and don't use the second envelope in exactly the right way, your ballot could be discounted. So it's really important to follow the instructions exactly and to educate folks about how to do that. And so with that, I'm going to go ahead and close out and pass on to my next presenter. I just want to summarize by saying every vote really does matter. And we also totally understand if you don't see voting as the most important tool in the toolbox, but I will still suggest that it is one tool in the toolbox that you can use. I'm going to drop a link in the chat box that you can use to sign up to get involved in this election cycle. And if you go back one slide, I do want to close by just reminding us of what is at stake. We are in an authoritarian fascist regime. We have literally the safety, the dignity, the protection of our people and our communities is what is at stake right now. And so we have the opportunity to rise up, go on record, demanding something different. And we have to, no matter what happens with the post-election count and the results, we have to show with a conclusive mandate that we pushed back on fascism. The people rose up, the people pushed back, and because we demand something different. That's what will give our allies and accomplices at all levels of government, in the judiciary and in other places, the tools to fight for us. If we don't fight for ourselves, they can't fight for us either. And the power is in the people. It always has been. So thank you so much. I'm happy to answer any questions.
Thank you so much for that, Nana. And I know you had a bunch of other slides that you sort of rushed through there. You can have time to go back to them a little bit during the Q&A as well. But next, I want to throw it to Jaron Benjamin, who is the Vice President of Community Mobilization and National Advocacy for Housing Works. He is also involved in Bird Dog Nation, a nationwide effort that stopped the repeal of the Affordable Care Act in 2017. And he also coordinates the Act Now End AIDS Coalition, a nationwide partnership that is dedicated to organizing and assisting states, cities, and counties in committing to ending AIDS as an epidemic. Before joining Housing Works, Jaron was the executive director at the Met Council on Housing, the oldest tenant organization in the US. And before his time at the Met Council, Jaron was coordinator for Vocal, New York's AIDS Housing Network. Let me throw it over to Jaron. Jaron, if you're trying to speak, we think you're still on mute. Still not coming through.
About now, can you hear me now?
We got it.
Okay, not sure what's going on there and why the sound wasn't working there. But I wanted to say thanks for inviting me to this panel. I'm always happy to be on a panel with those two wonderful women, and they've said a lot. I'm gonna fill in a couple of things here. My presentation, if you can hear me over my children, will cover about 4 things. One, just sort of sometimes the disconnection between voting and people's best interest. We can talk about why that is during the presentation. I also want to talk a little bit about Housing Works' voter engagement philosophy, and it's beyond just voter engagement. It's a kind of we want to go really big when we talk about civic engagement. Do more than just get people out to vote, and think about how getting more, increasing your voter turnout and building your community that way can really help you get more people in the streets, more people doing calls to legislators, more people really involved in a big way to help create change. I'll do a deep dive into our Get Out the Vote model, in case it's beneficial for anyone here, and then talk about the road ahead that has nothing to do with voting and everything to do with our with what our nation looks like next year. So first, before we go to the next slide, I wanted to just mention that Housing Works is the largest community-based organization that provides services to people living with HIV in the United States. However, our very small team of 5 people handle the advocacy of the organization. And while we are hyper-focused on things that happen in New York City and New York State, my team gets to look at some of the national stuff, which is why we got into starting Bird Dog Nation. I founded that because it was really, really, really important for us to start organizing people across the nation. So we'll go to the next slide, and I want people to be ready to enter some information into the chat. So on the next slide, on this slide here, you've got an electoral map. Does anybody have an idea of what year we're looking at? And just enter it in the chat, and I'm gonna wait. One thing I love to do with 2019, I'll give you a clue. It's a presidential election. So these are divided by who voted for a Democrat and who voted for a Republican. I'm saying 2000, 2016, 2012. 2012 is close, but it's not 2012. That's it, Drew Gibson. I see everybody's getting it. It's 2008. That's right. So 2008, this is what the electoral map looks like. And the folks in the red counties overwhelmingly, or by majority, according to the vote tally, voted for John McCain, and the blue voted for Barack Obama. Important to note that Democrats often, and this is a totally 501c3 presentation, Democrats often favor policies that expand the social safety net and offer more services, and will raise taxes in order to make that happen. Republicans, the folks in red, those policymakers often favor cutting taxes and allowing some of the people at the top of the economy to dictate more of where our economic policy goes. And there's a lot of things that go into that, right? They're usually like to trim down social services, et cetera, et cetera. Let's go to the next slide. And this is 2012. See, not really much of a difference. And we'll go to 2016, and this is the election between Trump and Clinton at the next slide here. Now, if you've been paying attention, the map hasn't really changed that much, right? Like a lot of the blue areas have stayed blue. A lot of the red areas have stayed red. My home state of Oklahoma, I hail from Tulsa, was the only state in the entire union where every county went to the party that wanted to cut services and wanted to move away from expanding the social safety net, which I have some feelings about that, but I won't get into that here. It's important to note, though, and this is one of the reasons why I wanted to show these electoral maps, is because it's important to have this discussion about how communities or districts or counties or states may vote one way, may have a vote tally that says one thing, but people's lives tell us a much different story. Let's go to this next slide, which will give us an insight into something that everybody cares about here. This is old data, but I wanted to use 2010 because I'm going to use 2010 for another map in a second. But this is people with an HIV diagnosis per thousand population, per thousand people in the population. And you can see that some of those same spots where we saw a lot of folks, a lot of counties that went to a party, that voted for a party that pledges to cut taxes and cut the social safety net, to roll back protections for people with pre-existing conditions, that those folks' self-interest weren't necessarily represented. And let's go to the next slide. And these are poverty rates. Some of the same, again, and I can't say this enough, some of the same districts that that voted for a party in the presidential election that pledged to roll back protections, that pledged to narrow the social safety net, and to benefit people who weren't poor and weren't living with HIV, right, and weren't living with other chronic conditions, that those same districts were inhabited by people who had greatly benefited from policies. Well, at least it makes sense to me that they would have benefited from policies that would help low-income people, help people living with HIV. And I think it's important to sit here with this data and think about why. There are a lot of reasons for this. There's voter suppression. I think that some people who follow the news may have seen that the Trump campaign was engaged in very targeted voter suppression in 2016. There's gerrymandering as well, which makes it tougher for people it kind of, you know, it is true that every vote counts, but if because of the way gerrymandering works, you may be in a district that votes that has communities that don't look like yours, and those communities may not say that they have the same self-interest that you do. And there's also disenfranchisement, right? People may be following what's happening down in Florida, and where there's been money raised to pay off what's in effect a poll tax, right, that stops people from voting. So there are a lot of reasons why this doesn't happen, and this is the reason why it is important to do both, right? Elections only happen once every 2 or 4 years, or locally they happen every year, but it's not something that you can do all the time. When you're involved in year-round civic engagement, whether it's getting in the streets, whether it's going to Washington, D.C. and making your voice heard, or whether it's having a meeting with your representative, or inviting them to a forum that you've constructed, right? That helps you be engaged year-round and helps you exercise your power over the government. One thing I want to point out, and this is one reason why I didn't watch the debate last night, is because I never watch debates. I can read about it in the morning. The important thing to note is that while the people that we vote for and the people that we elect will have a lot of power, we are the ones, the folks who are the social justice warriors, the folks that are fighting for our communities every day. We're the ones that are supposed to set and dictate which way this country is supposed to go. We need to tell them what needs to happen. It shouldn't be the other way around. So while I totally understand how sometimes there are some lackluster candidates out there, you remember that we need to get people out and vote. And just because you're going out and voting for somebody means that doesn't mean that you're going to abdicate your desires and wishes for your community, right? Let's go to the next slide, and I want to talk a little bit about our engagement philosophy. So, like I said earlier, we don't just believe in voting or engaging people to vote, and also engaging in robust and relentless advocacy. We like to put the two things together. So something that we've done every 2 years is a voter survey, and I want to do a little bit of diving into this data. So let's go to the next slide, and we'll bring up this next bullet point. So Housing Works, both clients and staff have high rates of both registration and voting. So about 4 out of 5 of our entire community, we have about 1,000, or at some point we had about 1,000 employees and served about 5,000 clients. And thank you, Wanda, for that. I have a habit of reading all the comments. So about 4 out of 5 are registered, and a pretty high turnout rate as well, right? We wanted to go into that data a little bit more, though, and to see like what is making some of these folks tick. So next slide, and we'll look at this next bullet point. We saw that advocacy really, really mattered, and that clients, and when I say clients on this slide, I don't mean people who go to our thrift stores. I mean people who live at a Housing Works or Bailey House residence, or people who receive services from Housing Works, that they were almost 3 times more likely to vote if they had engaged in advocacy that year. So part of that is that that not only do they feel like that voting is just this exercise they can do, that they can participate in democracy, but they go out more than once or twice a year and participate in democracy, and they really take that home with them. We see that they connect to other folks. People bring their friends out to these things, and people wind up bringing their friends out to vote. You know, we've done some anecdotal surveying and found that that a good number of people who are just active just stay active. The next slide. And also that civic engagement does affect the beliefs of people on that people have on ending AIDS as an epidemic. I want to take a second just to make sure, just so we have the same terminology here. When we talk about ending AIDS as an epidemic, or when people at Housing Works talk about ending AIDS as an epidemic, that is targeted language that we use to push the New York State government back in 2014 to really focus on making the lives of people living with HIV markedly better, and doing whatever they could to get folks to an undetectable status. Just want to make sure that's clear. And that eventually, once Act Now and AIDS got up and running, we were pushing the various jurisdictions to do similar plans. And eventually the current administration, under the guidance of Tony Fauci and Bob Redfield, launched their own plan. But that is a totally different presentation. Next slide. So now I want to talk a little bit about our Get Out the Vote model. And it's actually pretty straightforward, since we've got a good number of folks that live in our residences and that we've built community with. This is one of our posters that we've got up in our facilities and in our offices. We've got our voter toolkit. Actually, if you want to check out our voter toolkit and you live in New York, you can do that, bit.ly/HWGOTV 2020. All right, next slide. So we're not just focusing on people that live at Housing Works residencies. We're focusing on our entire staff and other community members, including people that next slide, and we'll talk a little bit about that. So there are a couple of different levels, or a couple of different ways that we do this. One is that we make sure that everybody in the organization, so that they understand what is at their disposal, what the advocacy department has made available to them. We've got a voter toolkit which talks about deadlines, registration dates. It actually has the forms in English and Spanish. That poster is in English and Spanish. We do video explainers and webinars, and the next slide will show exactly what we're doing, or something that's a little bit more specific. Our community organizers are in close contact with the site directors, because we really wanted to really focus on people who live in our residencies, because those in New York City, if you're talking about, say, 100 or 200 votes, well, that can swing a city council election, which gives us a lot more power when we go in and talk to an elected official. And we have a residency, and we have a housing site in their district. When we start talking, we're not just going out to get arrested at your office, but we also vote. We can not just make you look bad in public, but we can actually end your career. And that tends to hold a lot of sway with elected officials. Next slide. And anybody who's come into the facilities at all, whether it's to engage in adult day healthcare or to receive other life-saving services, full disclosure, I actually receive my primary care through Housing Works. And so sometimes, and it's really funny, when the nurse and the doctor will make sure that I've got a voting plan and that I'm registered to vote. And I'm like, that's great. Don't assume. Everybody should do that. And that's something that we make sure that everybody involved in our community is getting that stuff. So that's our model. We really try to keep our staff free because there's a lot of troubleshooting. I don't know if people have seen this, but there are about 100,000 misprinted ballots that went out in New York City. So before the story broke, we were kind of freaked out. But we stay available for troubleshooting. If somebody got kicked off the ballot or kicked off the rolls, we try to help them get back on. We keep track of voter registration forms that we've submitted, so that if the Board of Elections says we don't have it, we have a receipt and we have a copy of it that we turned it in. Next slide, and we'll start to move towards the end. So the road ahead. This is a weird time for us. One of the highlights of my career was 2017 when Donald Trump pledged to repeal Obamacare root and branch by day one when he got into office. And we organized things like this, where Senator Cassidy showed up to his own town hall, and we had turned it into a referendum on the Affordable Care Act. He got shouted down at his own town hall and booed off stage. And we did that over and over again until they stopped holding town halls, the people who had pledged to repeal Obamacare root and branch. We'll go to the next slide. And yes, he was not very pleased. There's me again when I had much longer hair, getting dragged down the hall in Dirksen, which is one of the Senate office buildings, and great photos of women from PWN getting arrested. That was one of the organizations that really threw down in this fight. That was wonderful. The world has changed right now. This is not the sort of advocacy that we can engage in, but there are other things that you can do. Guess what? Elected officials aren't necessarily always in conference or on the floor anymore. Some of them are attending things virtually. Elected officials, especially right now, I mean, things are changing a little bit now that we're getting so close to the election. You've got a chance to be able to just to get somebody who you normally wouldn't be able to get on the phone or on a Zoom call. So if you're with an organization, which a lot of you are, think about, especially after the election, how you can get these folks on the phone to ask some really, really important questions about what they're going to do for people living with HIV, what they're going to do for people who are low income, what they're going to do for our community overall, what they're going to do to help Black lives at least matter to everybody in the United States, right? Let's go to the next slide. These days, organizing around the empty seat that's been left by Ruth Bader Ginsburg has kind of taken over my life. I started working that Friday night after it happened, and am still working, haven't stopped doing it. Let's go to the next slide. I'll put an opportunity to sign up for some things that we've got going on in Washington, D.C. right now. Every morning at 8:30 a.m. on the weekdays, Center for Popular Democracy and some other allies are joining us in hosting protests for slowing down the process of filling the seat. And there's a lot at stake. I want to just share a quick story about me and my family. My mother's uncle died at the age of 3, so it would have been her uncle had he lived longer than that. And like I mentioned earlier, we're from Oklahoma. The reason he died is because he had tetanus, and the veterinarian that they took him to didn't know how to treat tetanus in humans. I'll say that again for effect. My mother's uncle died at the age of 3 because the vet they took him to didn't know how to treat tetanus. Back then, Black people were not allowed to did not necessarily have access to doctors that treated humans. So that story while painful as it is, and feels like it was about 100 years ago, it was almost 100 years ago, it can seem far away, but if you look at what's going on at the border, with children in cages, immigrants being sterilized and having hysterectomies performed on them without their consent, and as brutal as that policy is right now, you've got to understand that there has been some inhumane policy going on at the border for at least 35 years, right? What's at stake right now is, I think there are a lot of people, there are a lot of people that have said a lot of things. I'll just say this: people of color, Black, Latinx, Indigenous folks, and other people of color can take a couple of steps back, depending on what happens in this election, or we can take a couple of steps forward. Right now, the way I sometimes cap that story about my uncle is to talk about how we're not, at least we can go to the doctor. At least we don't have to go to the vet. Let's get out there at this election and make sure we take steps far away from those days, right? And making sure that everybody, whether they have citizenship in this country or not, is treated with dignity that should be given to them just by being born as a human. Thanks so much, and I'll be around for question and answer.
Thank you so much, Jaron, for that really powerful presentation. We will get to Q&A in just 1 second, but before we do, I wanted to acknowledge that some folks in the chat have brought up the need to acknowledge and celebrate the life of Timothy Ray Brown, also known as the Berlin patient, who died after a long battle with leukemia, I believe yesterday. So just holding that up, that some folks in the HIV community are grieving, and to remember his memory. Going forward into the Q&A, I guess I'd want to start off with Nana around a question around sort of your entreaty for white folks on the call to get our people. Do you have any suggestions, and this goes for the other panelists as well, around the best ways to confront people that are your family or friends who may hold problematic views in ways that can get them to listen as opposed to tuning you out?
Yeah, that's such a great question. Thank you. And, I do a lot of work in my own community. I'm part of an organization called Asians for Black Lives. And so, a lot of what we do is we do direct action and throw down in solidarity with and taking leadership from Black leaders. But also part of the work we do is commit to educate within our own communities around anti-Black racism, attitudes, and things like that. And so I do think that there are a lot of things that we can do. Anybody who is a white person or a non-Black person, or who's not an immigrant who wants to be in solidarity with those communities, or who's not Muslim who wants to be in solidarity with those communities. And I think that fundamentally, a lot of this really comes down to just having real conversations with the people who know you, love you, and trust you. Many times attitudes are, attitudes that are like prejudiced or discriminatory, or that are sort of like othering someone or blaming someone. Often those are really grounded in either misinformation or pain, or both, or some combination of those, right? So I think we have to start, certainly with recognizing that a lot of people are suffering right now. Most of the folks we know are suffering right now. People are suffering at the hands of capitalism, unbridled capitalism that has led to severe economic pain for a lot of people, particularly right now in this moment around the recession, around the pandemic. People are suffering from fear about what is happening. People are suffering from, white folks suffer from the effects of white supremacy too. And people are suffering from like the effects of patriarchy and toxic masculinity and all of these types of things. And so I think that it really, I think that this is really about like, what are the conversations you have when you go home or, when you go to visit family around the table? How do you, what steps do you take to be an ally or accomplice in those spaces instead of just checking out of the conversation when something is said that is like problematic, it's racist, it's a microaggression, it's transphobic? What do you do to actually, challenge those moments and use them as a gateway to engage the people around you? So I think that this is, I think that people can, I think that everybody knows who their, their like problem uncles and aunties are and cousins who are in our phone, who we can contact right now, 34 days before this election, and start talking to them this week. Make a list of like, who are the 5 people you could reach out to and start talking to about what's going on for them? What are they thinking about this election cycle? A lot of folks are getting a ton of disinformation intentionally targeted to them on social media and on mainstream media, particularly if they live in a swing district or swing state. And if you watch a movie like The Great Hack or The Social Dilemma, you'll understand how some of those techniques work. They're actually very sophisticated, like folks are being targeted. So yeah, that's a little bit about what I would say is like, make a list of like 5 or 10 people you can reach out to in the next like 5 days and commit to doing that. Like this weekend, take the time to make 2 or 3 of those phone calls with your family members and work on them. They know you, they trust you. It's different than receiving information from like a campaign or an organizer or a phone banker or a text banker. You are their people. You have an opportunity that we don't have. And the burden has been placed for a long time on Black people and non-Black people of color to fix things. And really, we can't do this. We certainly can't do it alone. White folks need to come through and step up and take leadership.
Thank you for that, Nana. The next question that we have that either Aisha or Jaren can answer, maybe both, is more of a general one, but sort of what should we be prepared for after Election Day? What do we need to be engaged in after Election Day, and how can we make sure that our communities are safe and have the resources that we need after Election Day if there is prolonged unrest and violence, given the unique needs of people living with HIV?
I'll go ahead and start. I think one of the things that we have to realize is that given the number of folks who will be probably doing the mail-in ballots, the decision might not be made on Election Day. So I think that that's the first thing to be prepared for. This might not be like past elections where you can kind of watch everything and see how the votes are coming in and expect a final decision on election night. I also would encourage folks to be prepared for there to be some level of dispute from the current administration. There have been numerous times when our president has been asked about whether he will turn over power peacefully, and there have been some quasi answers, mostly kind of avoiding an actual answer. So I think the first thing I would say is to just prepare to not have an answer that night. The next thing that I would say is to make sure that you know who in your community you want to, I guess, be with or near in that time. I know a lot of folks are talking about the possibility of civil unrest happening. I know that a lot of folks are feeling very uncomfortable about what's been going on. And I don't think that these are unfounded concerns. So I think the other thing that I would encourage is to make sure that you are in a space that feels the safest to you. And I don't mean just physically, I mean also emotionally, right? So if you live in a community that does not feel that safe to you, if you can stay with a friend that night, I definitely understand wanting to do so to try to make yourself feel as comfortable as possible. The next thing that I think I would like to stress is that folks really understand that right now, what we're talking about with this election and this pandemic, on top of everything else, is that everyone is kind of at a heightened state. We have been living through a situation that most of us have never experienced before, unless we were around during other previous pandemics. So this is not something that we can really have all the answers for. So I think you have to figure out how to feel as assured as possible with not knowing everything that you might have been able to know in the 2016 election or the 2012 election. This is not that scenario. So I think the thing that I would encourage is, if you're concerned about your safety or your access to food or your access to medications, especially given like the community we're talking to right now, I would say see if you can have all the prescriptions filled ahead of time, get those 90-day refills if you have access to them. I know that a lot of states have extended the longer 3-month medication refills because of the pandemic. I would say make sure you have that done in case you don't feel comfortable leaving your home. I would also say make sure that you have numbers memorized. If you are someone who likes to go out and participate in protests, I would make sure that you not only write down your own information in Sharpie on your arm, but also write down the number for any local legal aides who you know are either on site during a protest or who can help you, like a bail fund that might exist in your city or town. And then also make sure you have the number of an emergency contact as well. All those things need to be in Sharpie. All those things need to be in a place that's easy to see and access if you need to call someone immediately. I also think that this is a time for us to remember that we're not alone, okay? So even if something is feeling dangerous, heightened, if you're feeling really unsure and feeling all this unease, just remember that right now, for example, we're in a room with 160 people talking about this, right? You're not alone. You have other people who care about these issues. Find your people, right? That can be family, that can be friends who are as close as family or closer than family, but really find your network of people who help you feel safe and help you access all of the resources that you need. I think that it is one of the most, I guess, precarious elections that I can remember. I don't really remember another election where we had a sitting president not just like affirm that he will like peacefully hand over the office if he does not win. So I think that this is just a very difficult time for us to expect the status quo to continue. So just do all of those things and have all those assurances that you can before election night hits.
I'll just add, don't expect an election, don't expect a result on the 3rd. Probably don't even expect it that week. I would say that you should probably just start making linkages to organizers that you know, and be prepared to go out and march to protect the integrity of the election. I've got a link coming from one of my staff members who's going through those trainings right now. And it's an online training that you can attend. They'll teach you the ins and outs. And that's all I've got. I think we should do a really good
And
job.
if I could just add a couple things around safety. I think that right now is the time to build relationships with, if you don't already have relationships with like local organizations that throw down on direct action and know what to do and know how to do it and have safety protocols and things like that. Your local organizations are thinking about this right now. You know, we also saw news about new ICE raids coming, like folks are preparing. And so you're not just rolling in on November 3rd without knowing who the players are in your own community. You want to know them, you want to be known. There are also infiltrators in many of these settings, and we need to be prepared for that too. And so if you can take the next couple of weeks to like try to build those relationships before this moment that is probably going to demand a lot more of us in terms of direct action, that will keep you safer and your community safer. And then the other thing I would say is like start making a plan also around how you will contact people and let them know you're safe, and how you will check on your folks and let them know you're safe. Build a phone tree. In other, there have been other places where phone lines got cut down or internet went down, or like, we have to be prepared for multiple scenarios. And so, have a plan around, like, if it's your clients, your constituents, your family members, your friends, like who's going to contact who, right? And check in on them and see if they're safe. So these are just some more things to think about.
I think one thing I will also add, I know a lot of folks have said this before, that they're thinking about trying to leave the country and go somewhere else because of this election, or because of how the current administration has handled things. I encourage everyone to really think about what that means. I know a lot of folks who are talking about leaving might not have considered the extreme privilege it is to say that you will flee a country if something feels uncomfortable for you. And often aren't considering what will happen depending on where you go, right? We're still in the middle of a global pandemic, and you're in a country that has not had the best medical response to that pandemic. So not only might you be endangering folks in terms of their own health, but you also might be taking with you some really ugly ways that a lot of Americans kind of carry with us as we travel. So I think that folks who I know a lot of people say it jokingly, but honestly, this is not the time to kind of joke about leaving and going somewhere else. It's just, yeah, I think that we have to be careful with those kind of really broad comments that folks like to make.
So we have 5 minutes left, so I'll go with a final question for all of the panelists. But someone asked, what can we do to address the essentially hostile takeover of the Supreme Court? And is this something that can be in any way mitigated or stopped in the short term, or is this a much longer game?
I'm going to just go ahead and say that I don't think that there is anything that can surprise me from this administration. So I would not be surprised if this administration tries to force through another Supreme Court nominee in the next 4 or 5 weeks, or even beyond that. I think that folks who watched the debate last night heard President Trump talk about having more time even after the election to try to push through a nominee for the Supreme Court. We also know that even though the GOP was up in arms about President Obama nominating someone to the court, that they're not sticking to those same, talking points right now when we're this close to an election. So I think that the thing to do is to keep reaching out to your elected officials, keep voicing your issue with anything like this happening before we are finished with this election, especially because we don't want someone put into the Supreme Court who is going to be against the Affordable Care Act. Like, this is a case that we know is going to be going up very soon. Right. So I think that that's the thing that I would say, is just keep reaching out to your senators, especially for those senators whose seats are up this election. So make sure that you are writing, calling, like Jaren said earlier, this is a time where people you might not have been able to get on the phone, you might be able to get on the phone because we are this close to an election. Right. Unfortunately, there might not be that much outside of making those calls, sending those letters, sending those emails, just because I don't know of, anyone trying to go to DC and like stand in the Senate to disrupt anything, but just continue
Actually, we are. I wanted to break in.
There we go. There we go. So
first, very quickly, a timeline. Right, and this is, I've been on the phone with folks who are in Schumer's orbit. We got Schumer's donors to call him on his cell phone and threaten him that if he didn't do everything in his power to stop the nomination, then he might be cut off. With Zephyr Teachout and some other people, there may be about a handful of people who really understand how the Senate works. And we've got a couple of them to put together an 18-point memo that outlines every procedural trick that Chuck Schumer can take. That memo is out. There is an article on The Intercept about that. I can give Drew the memo because I got the original draft of it. But the important thing, and I posted this, posted a link in the chat. You can click there. We've set up a hotline that you call it. It connects you to your senators and then connects you to Chuck Schumer. Because here's the deal: Chuck Schumer actually has the ability to blow up the Republican deadline. Right now, if we had never gotten involved, they would be out in recess right now. They would have adjourned, and none of the tricks that Chuck Schumer could use would be valid anymore, because the Senate operates on unanimous consent. I want to explain unanimous consent right now. But it's important to note that once the Senate adjourns, then the Senate Judiciary Committee is on a glide path to confirm the nominee. They want to schedule the hearings for October 12th that week. We're thinking about doing some civil disobedience, and I know a lot of people who are going to sleep out on the steps of the Supreme Court. Get at me if you want to get in on that. We're having an action on tomorrow at 8:30 at the Supreme Court and on Friday at the Supreme Court. We know that the Republicans expect the week of the 19th to be a bunch of delays by the Democrats, and they want to have a final vote report out on October 26th and have a final vote on the 28th and 29th and the 30th. Now, but real quick before we go, the reason why they want to do it like that and send people home is so that there are about a dozen or so very vulnerable Republicans that need to go back in district, need to raise more money, need to kiss more babies, or whatever they're going to do in the age of code, right? They've got to make all that stuff happen. And if they're stuck in Washington, D.C. that close to an election, it blows up their timeline. So if we can disrupt the timeline, move it back by a couple of days, then just like we saw with the Affordable Care Act, if the other side has to recalibrate and count votes again, then everything gets a little bit tougher, right? If we blow up the deadline on the 29th and 30th, chances are that person won't be seated by election day. And ruling the hearings for the Affordable Care Act are on November 10th, right? So that also impacts that as well. So I want to try to find all the resources. Definitely click on that link, and let me see if I can enter another link in the chat for anybody that wants to go to Washington, D.C., or to be involved at all in any of this awesome stuff. You can hit us up here. I'm just going to put the bit.ly link here.
Thanks for that, Jaron. And just one more piece of business that Carl Bologna, our Vice President for Policy and Advocacy, just let me know that a district court ruling has basically made it so that the Trump administration's efforts to end the census counting at the end of September has been struck down. So even if they do appeal to the Supreme Court, it looks like we will have continued census count through October. So if you have not filled out your census forms yet and had yourself counted, please do so. If you know folks who haven't, make sure they get that counted. It will mean a lot in terms of how our votes will matter over the next 10 years. We also have a social session, a social group on Zoom happening next from 4:30 to 5 o'clock. Hopefully someone will post the link to the Zoom in the chat. There it is. And we encourage you to go there. We breakout sessions like yesterday. And before we go, I just wanted to read a short passage from a woman named Nadezhda Mandelstam. She was a Russian Jewish writer and poet whose husband was executed under the Soviet Union by Stalin for speaking out against the regime. And this is sort of her talking about whether or not it's right to scream when you're being oppressed and being trampled. She wrote that, "I decided it's better to scream. Screaming is a human's way of leaving a trace, of telling people how we lived and died. By this scream, we assert our right to live, sending a message to the outside world, demanding help and calling for resistance. If nothing else is left, one must scream. Silence is the real crime against humanity." Our vote is part of that scream. Us protesting in the streets is part of that scream. The advocacy we do in our organizations is part of that scream. We cannot be silent. And thank you so much to Nana, Aisha, and Jaron for their words. And we will be sure to follow up with more ways people can be active in the coming weeks before the election. Thank you so much, and please enjoy the unprogrammed social time.